I have 3 teenage daughters. I'm in the process now of starting to write them letters for after I'm gone, and it's very hard to imagine what they need to hear. So I just want them to have me for as long as they can. I was first diagnosed with ER/PR positive HER2 negative breast cancer in January of 2018. I was having some serious back and shoulder pain, and I thought, oh, this is aging. I threw my back out, but it was pretty severe pain, so I thought it's better to be, safe, and I called my oncologist, and I had scans, and I found out at that point that the cancer was in my bones, liver, and a little bit in my lung, and that I had metastatic breast cancer. We were honest with our children that it was incurable. I knew it was a death sentence. My husband knew. My husband's mother died when he was 13 years old of breast cancer. I'm actually really, really in love with my husband. And I was home alone in the house for one night, and I could not believe how quiet and lonely the house was. And I was thinking of my husband being alone in the house without me, and it was crushing. And also just the thought of being the cause of my kid's biggest trauma is heartbreaking.
Valerie had had a tough course with her disease. When she was first realized that her cancer had come back, obviously she was devastated. But I thought, we have really good standard treatments. We talked about how hormone receptor positive breast cancers can respond to hormone-based treatments. You just get rid of the estrogen and you add a targeted drug, and oftentimes these drugs can work for a long time. She did not have a good response, and in fact, her disease started growing quite rapidly within her liver when she got these hormone-based therapies, and we knew we had to change directions quickly.
So prior to this clinical trial, I was in excruciating pain around the clock. I was taking Dilaudid, which is an opiate pain medication. I had a pain patch. None of these things were really working really well. I was in pain pretty much 24 hours a day.
I've been doing drug development now for over 15 years. And sometimes the opportunities to do things are limited by what drug companies are willing to fund. But now I see that one can do things that, are in the patient's best interests with funding that's going to allow novel ideas to actually happen. Again, there are not very many ways that you can take a new idea and make it move forward. But Gateway gives me hope that there are people willing to fund creative ideas that are hopefully going to have a huge impact on patients' lives.
Very soon after starting sacituzumab, the pain just started floating off of me. I was just stunned at what a huge and amazing response I had to this medication. And really the hope that it gave me was that if I'm in a place again where I'm unwell, that things can still turn around. And that is something I learned from this trial. Giving somebody who's got 3 kids just a couple more years, it's a world. That's why I will claw my way through every inch of extra time that I can get to give them a better chance of solidifying who they are and being comfortable in their skin. And there's nothing more precious in the world than time. And giving a family their loved one for longer means everything.